Thank you, Ms. Anderson, for these wonderful stories of human participation. Majesté, Excellence, Mesdames, Messieurs, après...
Majesty, ladies and gentlemen, colleagues, after these very instructive presentation from our foreign experts, the time has come to invite the various ministers, Mr. Van den Broek, Mrs. Montréal, and I will ask you to take your seat here on the stage. We will now have a roundtable with the young people, and we will be able to have an exchange between the policymakers and the young people. So this roundtable will be led by the organizing committee by Professor Veronique Delven, who's head of the Department of Child Psychiatry at the Queen Fabiola University Hospital for Children. And the roundtable will also be led by Professor Joke de Neckens, who's an ordinary member and former administrator of the Antwerp University and former administrator of the Royal Academy of Medicine in Belgium. Colleagues, the floor is yours.
Welcome, Excellency. Bienvenue, Excellence.
Welcome, Excellencies. Welcome to you, youngsters. I also would like to thank the young people who over the past 2 years have been working on organizing this symposium. This is the Queen Symposium, of course,
of our youngsters who have worked with us a lot. So, we zijn heel blij dat u allen hier van...
Auprès de nous. We are delighted to have you here with us this morning, and we do believe that this is a unique occasion to talk about supply and offer of medical health care. And today we have the opportunity to make supply and offer match. And I would like to give the floor without further ado to Xavier, but I've just been told that Xavier is not with us. So perhaps Chiara or Lawrence, would you like to share your experience? I hope you can hear me. Good morning. Yes, so there was a first question regarding the integrated pathway of care. When my daughter was born, doctor said she was doing very well. And as a mother, I started to feel unwell, and that's where my nervous breakdown started. My husband tried to find help for our daughter and for myself. He called the childhood medical center, who were not able to give any answer. He called the maternity, who said that they didn't deal with the mother and children disorders. So how do you think we can have an inclusive pathway of care for both children and parents together?
Donc, je sais pas si
I don't know whether this is only for me, but first of all, thank you very much for your testimony. It was moving and really, really genuine, also very instructive. I'm responsible at the federal level with the INAMI and the healthcare. And currently we are developing a perinatal integrated health trajectory before, during and after birth. The challenge clearly is to make sure that there is cooperation between all the stakeholders at the federal level, with GPs, with midwives as well, gynecologists, And we need to work with childcare services and all the other services in order to create a follow-up, in order to be able to react early as soon as we see a problem arising. We will invest 10 million euros in this integrated healthcare trajectory at the federal level. It is a part of the answer. Maybe it's not the whole answer to the issue. Maybe other approaches are interesting. I was able to have a visit at the UDERF hospital, a unit for parents and babies, not only for mothers, by the way. There were also fathers there. It was a very interesting approach, a kind of laboratory, if you like. But as far as I'm concerned, developing perinatal health care plans before, during, and after birth is of the utmost importance in order to be able to act quickly, but also to be able to organize collaboration with all the concerned sector. I would like also to commend you for daring to speak your mind and expressing your what you went through. And I think your testimony will be able to make sure that some mothers understand that it is difficult. It's difficult to give birth to a human being, and your message is clearly showing a reality. More often than not, we are saying that everything is nice and beautiful, but there are other realities, psychological health realities, and we'll make it together or we'll fail together. Challenges are huge, as was mentioned. And during the crisis, we were able to work together. We were able to address challenges in order to take into account the situation of everyone from the outset. When there is a challenge, an issue for the baby, for the mother, or for the other person in the household, when it's easy, it's like a building, if you like. You take the lift and everything is fine. But once you have a problem, it's not the same. And you explained it in your path that was difficult. It's like you were taking the stairs with a door that has to be opened at every level of the building. So we need to change that. There is a reform of the first line so as to make sure that psychologists are involved, to make sure that GPs work together, talk with psychologists, with nurses, social nurses also provided by the childcare services ONE in the French Belgian region. All the stakeholders need to be able to talk together, to connect each other, rather than having you and your husband in a very difficult situation and all the others having to do it by yourself. It's important to have a health proximity involving mental health, and therefore, from September on, I think we'll be able to request all the mental health institutions to be involved in this participative process in order to make progress. Mr. Marron, would you like to comment? Yes? A few weeks ago, I had the opportunity to visit a new birth house in Forest in Brussels. It is actually supported financially by the community, and we are trying to go beyond institutional hurdles and to work together. Sometimes it's complicated, it has to be mentioned. This is a place where children can be born, but where you have support before and after birth, obviously with support from a hospital if there is a problem, for example. This approach cannot be extended everywhere from the very beginning, but it could be a way forward. The underlying rationale is more and more extended. I'm really sorry to hear that it was so difficult for you, that you felt alone in this, but fortunately more and more hospitals and maternity wards are developing postnatal support, because we know it's birth of a child, but it's also a difficult moment for the mother and sometimes for the father. So we need to encourage such kind of practices so as to make sure that we have much less women feeling alone. Once the baby arrives, you're alone at home. It's difficult, especially if it's the first one. Also, if there is mental or physical health issue, it's even more complicated. So once you come back home, the support needs to be more and more qualitative. But on a more positive and optimistic note, there are projects working to improve the situation. The onus is on us in order to improve them. Thank you very much. I think that continuity of care is a very important issue. Annelore and Chiara, you had a question? How to make sure that we accelerate access to healthcare? And how can we make sure as well that we simplify this trajectory, this pathway, to make it easier, to make it also more available to each and everyone, so that each and everyone is more aware of it? Of course, there are some waiting lists, and then the problems are getting deteriorated because of that.
Ik zou om te beginnen willen zeggen dat jullie hebben verschillende absoluut.
So, yeah, thank you. You raised essential issues. There are essential problems. We need proaction. We need to be quick. Support needs to be accessible. We need to come to your support. That's what we are trying to do at the moment. We invest 150 million euros in the rollout of first-line psychological support. It is of the utmost importance that children, teenagers, and adults as well find a first contact person, just to see what's the problem, to explore the current situation. We offer this for free in mental health networks, so you know which path to follow. Do you need more resilience? Do you have a particular problem requiring psychologist support? If you have a serious problem, then you would need a more intensive treatment. That's what we are trying to do. How can you find this support? Well, you need to to ask support in mental health networks. We insist on this point. We want to have a simple access. It must be easy to find. You find the network of your region, you can call it. That's what we are developing right now. I think we need to go further than that, though. Psychologists, orthopedagogists, healthcare providers need to come to you. Try to go and meet young people at the GP level, at the advisory center level. Go in classrooms. Go in support centers for pupils, for teenagers. You will be able to find people, young people that are struggling. We need to find places to develop all of that. It's not that easy. We are doing it. It's not easy. I hope that by October, November, hopefully, we'll be able to develop this process, this plan. You'll need to see critically whether it is working or not. That's what we are trying to do. Yes, you have the floor. Indeed, prevention is really important. Detection also is key. And I would like to emphasize the initiative of Frank Vandenberg, offering that GPs take care of young people until 25 years old. We need GPs to support those people. And we see that there are more early detections in those networks. You do not only need to go and see your GP when you are sick. You need to be able to have someone knowing how you feel, also internally. Mentally, how you feel. That's what we are encouraging with a global medical file. We need to make sure that every citizen have a global medical file so that each and every care provider can have a look at your file, understand what is your situation, and help the citizens, generally speaking. With the COVID crisis, mental health problems of youngsters were heightened. When we had the first feedback on the increases of mental health problems because of the COVID, it had an impact on social and healthcare providers. They were on the first line for themselves, but also for those of whom they were taking care. And for youngsters as well, as was explained during your comments. Many efforts were carried out in order to strengthen mental health services. Fortunately, the project mentioned by Frank has been implemented. And on top of that first-line psychologist at the regional level, we strengthened the mental health services with a focus on youngsters in an outreach effort, making sure that GPs, that doctors go and make outreach to reach youngsters. It's not easy to go to a doctor, to tell about your problem, to go and seek assistance. That requires a lot of effort. It's difficult. Therefore, mental health services have rolled out actions in order to go towards youngsters. That is what was required of them by us. Of course, more may be needed, but this is the logic we are following. I was asked to answer in German. I'll do it for the German speakers. About the comments of Mr. Maron, I think that is of the utmost importance. The COVID crisis showed that children and youngsters need a higher psychological support. There were different lockdowns waves, measures, and we can also talk about waves when it comes to psychological support. To address it, we need more psychologists. The federal level and the regions need to make sure that more resources are available to answer that increased needs. In the German-speaking region, we have an extra hurdle, the language. We need an extra support to outreach towards youngsters and to support them. We cannot do that alone in isolation with the current staff we have in the German-speaking area. Mieke is going to ask the next question.
Maar u hebt toch...
Nee, ik hoef dat niet, maar ik vind het gewoon elementaire leeftijd naar de jongeren die de vragen stellen.
Oké. Ik zal het vertalen naar het Nederlands, dat ook in onze Duitsstalige gemeenschap men werk maakt van...
I'm going to translate it into Dutch then. In our German-speaking community, we are working on the access, especially in the COVID-19 pandemic. It was difficult. There are not enough psychologists, and we need to work towards strengthening and improving networks. Psychiatry also, we haven't talked a lot about it, but we need more involvement of child psychiatrists, not only having private consultations, being able, therefore, to work in low threshold institutions. Then we have a language issue. It is a very small community, and many psychologists are working in the French-speaking community, but not a lot in the German-speaking community. This is an extra problem. Apologies. I thought there was a simultaneous translation, and you can always follow it using your headset, obviously, to get it. Comment was done off microphone. A question from Mika. Management is more often than not a spread between different stakeholders, and the right care is not always provided, and at a certain age the care is not provided. Here's my question. Which measures can be approved in order to ensure the management continuum, the care continuum? It is a very important question, of course, and let's draw attention to this. And this is also mentioned in the opinions of the Academy. As you have explained, youngsters from 16, 17, 12, 18 years old are cared for. Then they become adults, and they do not benefit anymore from targeted management. I'll try to be brief, and I'll mention the budget. We have launched a call for projects in youngsters and children psychiatry. Almost half of the budget, that means 15 million euros, needs to be completely used for that, for transitions, the problem we were referring to, not only age transitions, so that support can be granted when you are 16 to 20 years old, but also other transitions at the mental health level, from the psychiatric to the somatic level. It's important for anorexia, for example. Transition when it comes to the collaboration between the different institutions. And we want to bet on transitions, especially for the different age groups. We'll also bring something to our networks. We have support for that. The name is very complicated, by the way. It's called the continuum reflex. Networks will be provided with a tool that will allow them reflection, so as to make sure that they ensure continuity under all its forms among people, in the collaboration between the different institutions. In the network, we'll ask to have continuity. Please use this tool to make sure that you are working properly. That's of the utmost importance. When it comes to the involvement of society. Hello? Personally, I think that today it is a real opportunity to put forward our ideas and therefore to try and improve the health and the life of young people and children suffering from mental health issues. Do you think that young people could be considered as active collaborators and participants in the reform of healthcare, and how? I'll be very brief because I'm speaking too much. I think that the briefing we've had was really promising, encouraging. We decided to organize 11 coaches of participation in the 11 provinces. So these are individuals that are responsible for organizing and involving young people, young and children. Each network will have the support of a coach whose only mission is to organize the involvement of youngsters. That's we launched it. We need to see how it's working, but I think that is of the utmost importance.
Rapidement en complément pour dire que, par exemple, dans
Very quickly, to explain that in our health proximity network, what will help us promote collaboration between the different stakeholders are participatory discussions. We've asked all the users and patients through different organizations and associations to be involved, to get involved. The more the users and the citizens will be involved, the more they will be able to be at the heart of the organization to ensure more coordinated answers and responses. On top of this initiative of Her Majesty and of the Medicine Academy. This shows that we need to have more clarity in the way in which we have to improve the different mechanisms. Thank you very much. The international literature is really clear and is clearly, it's crystal clear. Fundamental issues, especially young people issues, can be solved through the involvement of the patients, of people themselves, of people having suffered from mental health issues. It is more and more integrated in health practices in the area of mental health, even though sometimes it's not enough, of course. And on top of what has been said by Frank, we'll create a specific participative process for youngsters and mental health in September or October in order to involve youngsters having mental health issues or whose trajectory is marked by mental health, but also involving youngsters that have no mental health issues, and also healthcare professionals to try and find new solutions, to try and be innovative. The involvement of the person in its own care trajectory is beneficial for the person. It is a part and parcel of the process. And it is more and more useful and beneficial if you belong, if you take ownership of the care trajectory. And this is bottom-up and no longer top-down. For example, this is your pathology, you need to do this and that in order to get better. No, we are trying to integrate people to make sure that patients are part of the solutions. And this vision is now more and more spread among healthcare professionals, and we'll be able to promote that in a specific project. In the German-speaking community, we have a council of German-speaking youth. We organize many awareness campaigns. And I think that it would be better, could be timely to organize a discussion between those youngsters and the different mental health care providers. This could be a solution that could be applicable in Wallonia, Brussels, or in Flanders. Thank you very much. Unfortunately, this is the last topic today that we'll be able to raise. It was chosen by youngsters, the responsibility of society. The floor is to Sana and Emma. Hello, everyone. Here is our question. How can we create a society platform in order to avoid the taboo existing when it comes to mental health and to be able to discuss about it openly? And how can we break this vicious circle of taboo, also taking into account the diversity of our country? when you suffer from a mental problem, if you are not from a Belgian origin, it is even more complicated to access mental health care. How can we make sure that this group of people is even more included? Well, the 2 points you raise are of the utmost importance. Stigma exists, and it was shown really properly in the video. We think it is important that access, the threshold to accessing mental health care is really low. And when young people tell us they have a problem, they are not sure about this problem, they need to be able to access this support very quickly. It must be easy to access it. Hence the need to have such an offer beyond the cabinet of the doctor's office. We need to go and have outreach towards youngsters in their schools, in their associations where youngsters are. Then a second point, there is still a lot of work to carry out, but we also need to bet on group work involving youngsters, because we can learn from each other and we can be able to talk with each other. The experience was really good during the pandemic at the university, with group sessions with psychologists, with a group of students, and it worked really well. I think that will be mutually beneficial. I think that is a part of the answer to your question when it comes to the origin of people, their situation, making it difficult for them to have access to those health care. But once you try to reach out to those people, it's going to be easier. This is about rolling out first-line care, and we are requesting pedagogists, orthopedagogists, and all the different healthcare providers within the system to take part in those group sessions and to reach out to the public. It is an essential part for us. I'm going to answer in a French answer. And just to let you know that in the Wallonia region, we have created an internet website called Find Support, Free Up your speech. And with influencers, we are trying to explain that it can happen to each and every one of us to be sad, to have a very difficult period. The first thing to do in such a case is to talk about it. It's not abnormal to have such a kind of thought. What's important is to be able to express it as soon as possible. We worked with youngsters, with grown-ups. We try to give advice online by using this kind of mechanisms, and I think that is of the utmost importance. We have strengthened many mechanisms, such as prevention centers, and focusing also on boys and youngsters. Men, more often than not, are reluctant to express themselves. That's why we focused on it. Then, second point you're raising, it is important to work on the training of healthcare professionals against discrimination and cross-sectionality you are mentioning. Sometimes it's difficult to go and reach out to a doctor because you are disabled, because you speak another language, because you are a foreigner, or for other regions, because you are LGBTQIA+, because you feel different, you're struggling to go and reach out to a professional. Hence the need to train healthcare providers. We see in statistics that these people have less access to healthcare, hence those initiatives. The question of the gentleman is made off microphone. It is therefore impossible to translate it. will be able to translate the answer.
Nous aurons l'occasion cet après-midi d'échanger parce que les workshops.
We'll have further opportunity to exchange in the afternoon during the working group sessions. Dear youngsters, do you have further questions? Now, just to react to what has been said, let me answer to your question.
Non, la seule réponse, c'est comment est-ce qu'on investit et qu'on...
So the idea is to invest and change vision, implement a new vision. In the Wallonia region, prevention comes upstream, but how can we hire 180 psychologists? The interpreter apologizes, but the gentleman is unfortunately not using a microphone, which means that we cannot hear him nor translate him. We have hired a new workforce through regional and federal sources of funding.
Monsieur, je partage votre difficulté. Je suis aussi à l'hôpital, excusez-moi. J'ai aussi une urgence.
I also work at the hospital. Our emergency wards are overburdened, but I think that any discussion that we can have within the networks among ourselves are very relevant. And this is why Her Majesty decided to give the floor to young people and to have this dialogue between policymakers and young people. I would like to give the final words to our youngsters, please, before we close the roundtable. Now, that was the point of my comment. It took me 3 months to receive help. And, you know, when you have a mental health disorder, very often people do not see that you're unwell. But during those months, I had many suicide attempts. But I could not wait for 3 months to get assistance. I understand that emergency wards are overburdened, but when it comes to psychological disorders, you're always faced with an emergency. Can I also have a say? Well, yes, of course, we are lagging behind, and there are huge shortcomings and very long waiting lists, but we are now taking action. And these are not just words. We are massively investing. Let me give you a few figures. I was referring to the First Line project of 152 million euros. I launched a call for tenders of 35 million euros. Projects are supposed to come in within October. This is a project for young people, psychiatric problems. And then we have a project of 25 million euro for the intensive care departments throughout the country. During the pandemic, we invested in liaising units between the psychiatric services and the intensive care services. We invested 15 million euros. We also invested a lot for those who are waiting for help. We have a new mobile units, emergency units, and therapies. Now, I do not want you to applaud me. I'm just showing and demonstrating, giving evidence that we are investing, and we are working day and night with the experts, with professional organizations. They're all included in our projects. We will also organize young people's participation. We work with your associations. We work with your representatives. I understand that you are losing patience. However, we also need to, and this is what we are doing, further to this dialogue, we are also taking action.
Je n'ai pas parlé d'une application.
No, I did not mention any app.
Non, mais il faut une batterie de solutions et je crois que ça vous partagez et ça explique.
Well, we need a whole array, a wide array of solutions. We need, yes, a diverse range of solutions. Now, well, you said that we are lagging behind. You said that healthcare professionals are raising the alarm. I understand that. We are aware of that. And as I've said, we do understand, and we did understand, that the COVID crisis would exacerbate the problem because, well, mental disorders are even more acute today than they were in the past. All the regions have made a lot of efforts. The Brussels region has rolled out means to help homeless people and the most vulnerable people. And we invested in mental health disorders. There are two pillars on which we have now more sustainable funding, namely homeless people, first pillar, and then mental health. Millions of euro of extra funding that were limited to 1 year or 1 year and a half have now been extended in the Wallonia region and in the Flanders region. So we have additional sources of funding, additional means. Now, when it comes to how these funds are being used, if, well, there are any urgent issues, then I think that the mental health departments have to point our attention to the problem, because we are there to fix any issues and to work with healthcare professionals to improve our action. But this is our main concern on a day-to-day basis.
Merci beaucoup.
Thank you very much. I thought there was one last question or comment. I'll be very brief. Now, there is another topic which is very dear to me, the reimbursement process and the level of reimbursement, which is quite poor. I know that you're working on finding solutions, but we receive a very low amount of reimbursement. And when you have to go to the psychologist every week, once a week, spending 60 euros is a lot, and this expenditure is a hindrance to the seeking of help. You don't have to convince me. I think that I'm very well aware of the problem. But let me come back to the first line services. So we cannot refund everything. This is not possible. We don't refund everything or every amount spent for physical disorders. We don't refund the whole amount spent for a chiropractor. Now, we want, when it comes to mental health healthcare, to have an offer of services that will help us diagnose the problems quite rapidly. Now, the first thing to understand is which expert you have to consult, and you can have a free of charge early diagnosis to understand which medical expert you have to be referred to. And then for €4, if you're part of the most vulnerable category of people, or €11, you can have an appointment with a psychologist. So I think that first-line help is very important. When someone is faced with a serious problem, then perhaps he or she has to consult a psychiatrist. What we want to avoid is that people continue going to a psychologist while the psychologist is not the proper expert. Someone who has a depression must be referred to an expert in depression. And when you have a physical disorder, perhaps you need more than one expert doctor to help you. Now, if you think that a young man or a young adult needs to be more resilient or need a group talk, well, perhaps then these young people should be referred to group talk. And now, of course, the refunding procedure is one of the issues, but well, yes, there are many others. Now, I think that this exchange was a historical exchange. It was one of a kind, and I think that perhaps you, as a minister, could organize this participation with young people. I think that, of course, we need even more financial means to act on prevention, but perhaps some ministers in charge of prevention are not attending this session. So we need to convey this message to them. Our experts from abroad have talked about the need of early diagnosis and have talked about the importance of participation. I think that we will need to work on a cross-sector basis because, well, the issues are very complex and are of various kinds. So this means that we cannot work in silos, and policymakers, political leaders will have to define protocols in terms of early diagnosis, in terms of prevention, without stigmatizing anyone, on the best type of support that can be offered, and the evidence-based diagnosis and evidence-based therapies. I think that the quality of therapy has to be fully met, and this is only possible with evidence-based policies. Sometimes there are therapies that are pointless and that should be discontinued. But we know that the issues are very complex and they require complex and various reactions. In 2 years' time, we will hopefully meet again and have improved our international performances in the field of mental health of children and adolescents. I'd like to thank all the members of the panel. I'd like to thank our youngsters, and we will, of course, keep in touch. Thank you very much. Could I please ask you to take your seat? Majesty, Excellencies, ladies and gentlemen, ministers, colleagues, we are approaching the end of this morning session that was very interesting and instructive. I'd like to thank you all for your attendance. Just some practical information. lunch will be served on the first floor in the marble room. You can reach this room through the exit doors and then take the lift or the stairs. Her Majesty, the Queen, and her staff will be the first ones to leave this room. Could you please stay seated until you are asked to leave the room? Thank you very much, and this session is now closed.